ba nalulungkot na tayong dalawa lang? Parang paulit-ulit na lang yung ginagawa natin araw-araw.
Nalulungkot? Bakit naman ako nalulungkot? Magkasama naman tayo.
Ayaw ba yung may aalagaan at mamahalin tayo ng panghabang buhay?
Mahal, di ba napag-usapan na natin to? Alam mo naman na may cystic fibrosis ka tapos carrier rin ako ng sakit. So malaki yung chance na magkaroon din si baby.
Gusto ko na ng anak. Sabi ng doktor, 25% lang naman yung chance na magkakaroon si baby, di ba? May 75% pa naman tayong panghahawakan na hindi siya magkakaroon. Mahal, pangarap natin to. Ayaw ba ilaban?
Pero hindi ba't sinabi rin ng mga doktor na mas maselan ng pagbubuntis mo dahil sa pagkakaroon mo ng cystic fibrosis? Ayokong isugal ka sa mga bagay na alam kong buhay mo ang kapalit. I, Badger de Coco, take you Sara de Espasol for my lawful wife, to have and to hold from this day forward, for better, for worse, for richer, for poorer, in sickness and in health, until death do us part. I will love and honor you all the days of my life.
I, Sara de Espasol, take you, Badger de Coco, for my lawful husband, to have and to hold from this day forward, for better, for worse, for richer, for poorer, in sickness and in health, until death do us part. I will love and honor you all the days of my life.
Today and every day of the rest of my life, I promise to be there for you. I promise to stay by your side through sickness and in health as your husband. Even when difficult times come along, your happiness shall forever be the most important to me.
If you have planned on getting pregnant and you are aware that you are diagnosed in having cystic fibrosis, make sure each of your healthcare provider knows about your pregnancy plans before you get pregnant. Just like on how Badger de Coco and Sara de Espasol consult to their doctor first. Because your healthcare provider will work together to help you get ready for pregnancy and stay healthy during pregnancy. And they will also be monitoring you closely all throughout your pregnancy journey, and they will help you to manage your cystic fibrosis and make sure you and your baby are doing well. Through newborn screening, cystic fibrosis can now be diagnosed during the first month of life, even before the symptoms may develop.
만약 네가 사랑을 하면 여리고 여린 널 안아주는 그런 사람이면 좋겠어. 만약 네가 사랑을 하면 표현에 서툰 그런 너에게 표현해주는 사람이길 마음의 문을 여는 속도가 조금 느린 널 이해해주고 사랑해주는 사람이길 바다같이 넓은 너의 맘에 마음껏 헤엄치는 그런 사람이면 좋겠어. 그런 사람이 널 사랑하면 좋겠어.
Even if Sara de Espasol died, Badger de Coco still continues his life for his lovely daughter, Meredith.
Ito ba ito si Bebe? Sandali.
He may not see his wife ever again, but without his knowledge, his lovely wife stayed by their side, guiding them all throughout their journey. Days passed by as Badger de Coco putting Meredith into sleep. He suddenly smelled and tasted familiar salty sweat on his daughter. It was like his wife's. Weeks later, Meredith had his first checkup, and it was also the day that her newborn screening came out. And sadly, she tested positive for cystic fibrosis just like her mother, Sara de Espasol.
Make friends with change when everyone's perfect. Can we start over again?
I'm so sorry, Mr. Badger de Coco. She also tested positive on cystic fibrosis just like her mom. We've already talked about this genetic disorder in the past, that it requires a lifelong management. But please do keep in mind that although cystic fibrosis is progressive and that it requires daily care, people who are diagnosed with this condition are usually able to attend school and work because there are some who doesn't experience these symptoms at all. However, they should follow a certain criteria so that their condition will not worsen. So, we are still lucky that we are on an advanced technology now. So, your daughter has been diagnosed early. So, that means that she will also be getting treatment as early as now. So, this usually results in the best outcome. But then I will be very honest with you, there is no specific cure for cystic fibrosis, but medications and other therapies can ease the symptoms. That is why I am administering some antibiotics which can prevent and treat lung infections, and some inflammatory medicines such as corticosteroids and bronchodilators that we will be getting from an inhaler, and also mucus thinners, and which will help to get the gunk out of the airways, and some CFTR modulators. This help CFTR work like it should, and they will make the lungs work better and help your baby to gain weight. And another one is the combination therapy.
For the nursing intervention, improve airway clearance, teach the child to cough effectively, and encourage to increase fluid intake. To improve breathing, position the child in a semi-fowler position, maintain the 90% O2 saturation, exercise to help loosen the thick mucus, and to prevent infection, teach the child to perform hand washing, have a good hygiene, and restrict contact with patient with infection. To maintain adequate nutrition, increase of caloric intake and protein such as peanut butter and cheese, eat salty snack, and to reduce child anxiety, provide activities to reduce the child boredom such as playing with toys, and lastly, for family support, encourage to voice the fear of the child.
Oh, anak, uminom ka muna. Yung mga bili ni daddy ha. Habat, palagi ka mag-face mask tuwing lumalabas ka. Tapos iwasan mo yung mahusok na mahusok na lugar. Huwag ka magpapawis ha. Tapos pag pawis ka, sabihin mo sa akin para mapalitan ko yung towel sa likod mo na. Anak! Anak, mahal na mahal kita. Lumaban ka naman, no? Huwag mo naman iwan si Papa. Alam kong gusto mo na makita si Mama, pero masyado pang maaga, anak ko. Dito ka muna sa tabi ni Papa. Hindi ko kakayanin nang wala ka.
Papa,